Today is the third annual Bell Let's Talk Day. It's a nationwide campaign to bring awareness to mental health and help end the stigma surrounding mental illness. Today, Bell will donate 5 cents in support of mental health programs across the country for every text and long-distance call on the Bell network or tweets with the Bell hashtag Let's Talk. CP24's Rena here joins us now to talk more about the campaign. Rena.
All right, that's what we've been doing all day today, Nathan, is we've been talking about mental health. We've been talking about the signs, the symptoms, and what you can do to help. And the big thing today is breaking down the barriers, asking the questions, asking someone how they feel, taking an extra step and maybe trying to figure out if someone's dealing with something, and also encouraging people that if they're dealing with something and they can't identify it, but they know they don't feel very well, to maybe reach out to someone, ask a couple of questions, and try to get some help. Joining us now is Dr. Katy Kamkar with CAMH. You're a clinical psychologist. Thank you so much for joining us. And I guess a perspective that some people don't pay enough attention to is that when you are in depression or you have some sort of mental illness, whether it's anxiety attacks, depression, etc., it doesn't just affect you when you're at home. You go to work with it. You carry it around 24/7. And especially in the workplace, it becomes an issue.
It does become an issue. It does become an issue at home, let alone in the workplace. And that's really because aside from home, the workplace is a primary location of the adult life. So really workplace becomes such a significant component of our daily life. And therefore, it plays a significant role in our health and in our well-being. And we know very much that suffering from mental health problems or increased stress at work is associated with reduced productivity, increased sick days, increased absenteeism. It could also lead to conflict at work. And of course, stress at work then can translate into stress at home, and then again back to stress at work. And then of course, all the suffering just becomes compounded.
Okay, from an employer's perspective then, obviously you want your employees to be physically healthy, you want them to be capable of doing their work, but you do want them to be mentally healthy as well. So what can employers do? I mean, if their employee comes in and says, I'm dealing with a health issue, I'm battling cancer, or I'm battling some other sort of chronic illness, employers generally are fairly compassionate, try to figure out how they can help. So when it comes to mental health, how far do we need to go, and what do employers need to do?
There are so many things that employers can do. For example, we know that workplace flexibility in terms of work locations or work hours can really help a lot of employees in terms of helping them to set a better balance between the work and their personal lives. When people have their work roles and duties very well cleared and specified, it can also help to alleviate a lot of anxiety and stress. Providing supportive reintegration into work after a period of absence can provide tremendous help as well. Quality social support at work as well. It's always beneficial.
And as an employee, as someone who might be dealing with something, you've been to the doctor is saying it's quite possible you're dealing with this, here's some medication, here's some additional therapy. What should you tell your employer? How much do you need to tell? What should you tell? What are your responsibilities as an employee as far as coming clean about what you're dealing with?
It is different for everyone. Some people then, feel closer to their employer and they're more comfortable sharing it. Others, they would like to take a different route. But I think what's very important is really not to suffer in silence, to really look at what are the resources available in order to seek help. And really there are effective treatments available. So it's very important not to seek help.
No,
to seek help and not to suffer in silence.
Unfortunately for some people, I can imagine an employer saying, or a manager saying, you know what, get over it. I know you're not feeling too good. Get your medication and just, get back to the job. And, I just don't want to deal with any of this anxiety anymore. We had somebody text us and say they were at a theater rehearsal and somebody said, this is not the time or the place for an anxiety attack. So clearly not very sensitive to the person who was actually going through something in the workplace around all these people, feeling embarrassed. What do we need to do about that?
It's a very complicated issue, right? It's a very important question and at the same time very complicated as well. In those cases, it's very important to seek support in that in those cases, if the person doesn't feel the support from one person, often they're able to problem solve it by looking at what are the other support system, social network system that I can use in order to get the help and the resources that I need.
All right, Dr. Katy Kamkar, thank you so much for joining us. We really appreciate it.